A component of combating the spread of coronavirus is getting people tested, but that can lead to risk for healthcare workers and other patients. And now an Encinitas doctor has begun a pilot program to empower patients to collect their own samples at home. 10 News anchor Jim Patton has the story.
Today, what we're going to do is I'm going to teach you how to collect a swab from your nose.
This is a demonstration of how telemedicine is being used in a pilot program in San Diego to combat the coronavirus.
Tilt up, yep, very good. Keep going, keep going.
Dr. Joy Hardinson runs her own practice known as Healthtopia in Encinitas. She has enlisted the help of her teenage daughter here to act as a patient to show how she recently guided 4 real patients in the collection of a medically viable sample at home.
You're not breaking the skin. It's a technique that doesn't require a lot of skill.
With proper guidance, the sample is worthy of being submitted for testing for multiple viruses, including coronavirus.
The main thing about it is that it's slightly uncomfortable, and it actually can trigger people to sneeze because you're tickling the back of the nose, which is another reason why we really should be doing this at home as much as possible, because when someone sneezes, they aerosolize the virus and are more likely to transmit it.
Dr. Hardinson says the patients taking part thus far have done quite well, but each case has to be assessed individually.
If a patient needs hospital care, if they're in respiratory distress, they need to go to the hospital. But as we know, the majority of these cases are actually mild, and we want to prevent the spread and save the hospital resources for the people that really need them.
And in a world now saving lives by keeping a safe distance, this may be a life-saving balance.
This is a way we can also practice social distancing and still get the job done.
You did a good job. That's it.
Telereporting on telemedicine in Encinitas. Jim Patton, 10 News.
And Dr. Hardison says what is really needed now are more test collection kits, as the swabs that need to be used are on the back order, though she does still have several kits on hand.